Okay, so the first cranial nerve we'll talk about, which is the cranial nerve 1 or the olfactory nerve. Okay, in reality, the olfactory nerve is actually these little small lines which are going right over here and passing through the cribriform plate of the skull. This little thing over here is actually the olfactory bulb, which gives rise to the olfactory tract right over here, which then again gives rise to the olfactory striae, which then insert into the temporal lobe of the brain. We also know that the entire limbic system is actually found in the temporal lobe. So the olfactory nerve has a really close association with the limbic system. Uh, an important correlate is that you can recall, or you might as well remember, that certain odors have an emotional component associated with them. For instance, some smells can actually make you very emotional or sad. For instance, some scents are actually sprayed on top of graves, for instance. And if you can actually come across certain smells in any, even at a party, you can actually start feeling sad, very sad. Okay, so this over here is the limbic system, this is olfactory tract. Okay, now another important correlate is that a baby, the first thing it the first sense it uses to recognize its mother is the sense of smell. And this is what actually causes an emotional bond to develop between the mother and the baby, or an emotional bonding uh, on part of the baby towards the mother. Okay, so this was the basic anatomy of the olfactory nerve, and now for some important clinical vignettes. Let's say a person suffers a facial trauma or an accident, and he ends up fracturing this temporal, or this cribriform plate. What can happen? He can develop something called anosmia, which is the loss of smell, or dysosmia, or altered sense of smell. Another important clinical correlate is that since the olfactory nerve has its insertions onto the temporal lobe, any abnormal electrical activity inside this inside the temporal lobe or the temporal cortex can actually give rise to olfactory hallucinations, or a sense of smell when there is actually no smell around. Another thing which you need to remember over here is that the olfactory nerve is probably the only nerve which does not end up on the thalamus. It ends up directly on the brainstem. Oh, sorry, the on the brain, not the brainstem. Okay, so this concludes our lecture on the olfactory nerve.